Hey there, nurses! Ever feel overwhelmed by drug calculations? Don't worry, I've got you covered. Let's break it down nice and easy. First up, the volume quantity to administer for oral meds and injections. Think of it as the desired overhave or formula method. Here's the formula. Volume to administer equals desired dose divided by stock strength, then multiplied by stock volume. So, if a patient needs 250 milligrams and you have 500 milligrams tablets, you'll give half a tablet. Simple, right? Next, let's talk IV drip rates. For ml hour, it's straightforward. Total volume to infuse divided by total time of infusion in hours. For example, if you need to infuse 1000 ml over 8 hours, that's 125 ml per hour. Easy. Now for the drops minute. Use this formula, total volume to infuse divided by total time in minutes, then multiply by the drop factor. Remember, the drop factor is specific to the IV set you're using. If you're infusing 500 ml over 4 hours with a drop factor of 20, that's 42 drops per minute. Got it? Lastly, dosage based on body weight. The formula is prescribed dose times patient's weight. If your patient needs 2 milligrams per kilogram and weighs 70 kilograms, that's 140 milligrams. Use this as your desired dose in the first formula. And there you have it. Essential drug calculations made easy. You've got this. Thanks for watching and keep saving lives.